Well, I haven't gone for that ride yet, but I thought this might be a good time sitting here totally cut off from the rest of the world uh, with no internet or no TV that I might make a sort of long-awaited comment on my part about the medical system in the United States. I know, for many years I lived in Canada, and of course that was 30 years ago. So I'm really not totally sure how it is now. However, my dad and my sister, a lot of other people I know still live there, and while they have some complaints perhaps on the medical system, nothing like we have here. And so this is coming from somebody who has health insurance. Uh, However, you still, like a lot of insurances, you pay a lot of money for it. You don't want to use it because you never know when you might have to pay more. Uh, so anyway, but here, I'm a believer that health care is something that everybody deserves. It's not something that you gain because of your social position or how much money you make. It's just something everybody should have. Look at that, the TV just came back on. Anyway, here though it is a definite caste system. Some, the people that complain about any change in healthcare, all are people that make a lot of money and have good health care. And you also have the other people that they're getting to be fewer and fewer. But I'll just mention, the Boeing worker. They have gotten forever full coverage on everything. They dental, eyes, just the full spectrum, and they pay, I think, nothing for it. So every time a contract comes up and Boeing wants to charge a few dollars more or a few dollars a period for their health care, everybody in Boeing gets up in arms about that, and it's such a crime. A lot of them think everybody has that. When you talk to somebody and you sort of enlighten them on the real world aspect, that if they were in many other jobs, almost any other job, they would have to pay a portion of their health care, and how much that is, they just about have conniptions on the whole thing. But anyway, I do not understand why we cannot redo or rebuild or even start from scratch, I guess, and build a new system. But the basics of the thing is that if everybody in the country is paying a little bit or their fair share towards the health system, that there should be enough money there to fund it and operate it. In Canada, and so I think a lot of European companies, the cost of the health care is in your taxes. I know it was in Canada, and so you didn't really see it. It just came out at the end of the year. You paid your taxes, and health care was in there. In my case, I pay around, single person, I pay around $250 as my share of the health care, which does not include dental or vision. But and my employer pays the other half of I think about 250. We're supposed to be 50-50, so there's a one person $500. A friend of mine in the elevator business who right now is unemployed, or he's paying for his own medical through his union, and he has everything in his, and he pays like $120 a month. But he's single, and if he was a family, he would be paying about $700 a month. So it's quite a wide stretch of what you could be paying for your health care. But if it was in your taxes, yeah, you pay a little bit more taxes. But again, it's one of those sight unseen deals. When you get your check and everything's out of it, you tend just to not think about it so much. When you go from job to job, your health care would go with you, like it does in Canada. If I was to quit my job, I'm a type 2 diabetic, I would have to go on to somebody else's health plan if they had it. So that would change my health plan totally. I may have a pre-existing condition for which I would not get any coverage for a period of time. So just lots of stuff like that. Now Obama attempted to change healthcare and did finally get some sort of healthcare change passed. But personally, I am really not sure if it's going to benefit us that much. It's still sort of set up to be optional. You're supposed to be by law have health care, so you're supposed to go out and buy it instead of it just being part of you and being paid for through your taxes. If you don't go out and buy it, then technically you may be fined. Employers are complaining how it would work against them, so a lot of issues there. When people say, well, Canada doesn't work, they have their own problems. Everybody has their own problems, but that doesn't mean we can't try to solve them. Another aspect of healthcare that sort of leads into this as well is from the doctor's end and from the billing end. I've gone to the same doctor again for these 30 years that I've been here. Pretty much in the same building, actually, I think. So I know once years ago I had a little cyst or boil that had to be lanced. It was just like a big blister, and basically it needed to be cut open and bled or drained and basically bandaged back up. That was all. It was in a place where it was very hard for me to, or impossible for me to see or get to, or I might have done it myself. But anyway, and of course I didn't know what it was at the time, but if it happened again, I could poke it with a needle, I think, and drain the fluid out of it. But in any case, I happened to see the bill on that one, and so I went to the same examination room that I go to today for my checkups, and that room all of a sudden was billed for like $700, I believe, and this again was probably 20 years ago. So it was billed for like $700, and it was now an operating room on the bill. The same nurse that comes in and checks your blood pressure and things like that, takes your temperature, was now a surgical nurse, and she was billed at several $100s. There was also several $100 cleaning fee for the surgical instruments that were used. But the bottom line is it was a 10-minute procedure performed by the same doctor and same nurse that would take my blood pressure and check me over. But there was significant charges or upcharges on the whole thing. So how does that affect the efficiency of the medical plan? The charges could have been reasonable. The doctor would have still made his same salary, and things would just be less expensive. But I think that you'd see that a lot in our system. It is all for profit. If you're looking in the stock market right now, even with the proposed changes, the insurance companies are still going to benefit. So pharmaceutical companies and medical insurance companies stocks, have been rising because of the extreme profitability. So we need to eliminate that. So why couldn't we say again that medicine really is going to be not for profit? There'll be no for-profit hospitals. Doctors will still make their good livings. Nurses will still make good livings. Everybody working in the industry will still make their salary. But the hospital itself will not need to make a profit. We will fund research. So I don't think that should be inhibited at all. And things would just be done reasonably. Also in the area of hospitals, perhaps we move a little bit like Canada, where every hospital perhaps does not have every piece of equipment for any possible procedure. When my daughter was born, we went to the Foothills Hospital in Calgary, and that's because that hospital was the birthing hospital. All of the any equipment was there for any procedures that might be necessary related to having a baby. Other hospitals, of course, you could have babies, but they might not have all of the equipment in some sort of an extreme scenario. So again, every hospital, perhaps a lot of hospitals would specialize, so you might have to drive a little farther. There might be a little bit more inconvenience in the whole thing. But then it has to be managed. So again, who says we can't manage it? If we use our heads and just manage it. And You know, maybe we take an insurance company and say, you're going to be the insurance company, or you're going to be the company that handles the medical scenario. It's not going to be a for-profit area, but you know, you will make expenses and that type of thing. So I think, you know, just create a goal of health care for everybody and start working on it. So anyway, just my 2 cents on the whole thing. Thanks. See you later.